information that I do. So I think at the end of the day, I have enough experience and confidence, and most importantly, run a business helping people. I currently coach thousands of individuals every single day. Do I collaborate with any PharmDs? Not specifically. There's a lot of pharmacists at the compounding pharmacies that I talk with, but I don't do any additional collaboration with them outside of that. John, like I was saying, the best way to go about getting prices would be to schedule that free consultation, guys. Myrna, the price for Tirzepatide would depend on dosing, would depend on if you're going to get any coaching with me. There's a lot of different options. And so I would encourage you to shoot us a message here and get yourself scheduled for that consultation. If you're on the starter dose, it can be pretty low, a couple $100 a month. And that's going to include labs, Myrna or Myrnav, and that's going to include access to my community and the lifestyle coaching. Myrnav, you shot us a text message? You never heard back from my team? I highly doubt that. I do have a pretty detailed team that responds to every single message. So sometimes those messages don't go through. I'm kind of thinking that happened. If you want to shoot me a text message right now, I can look on the back end and see if we got the message. Oh yeah, Tree Org. I agree with you. I don't blame them either. But at the end of the day, it's not an issue of blaming anybody. It's an issue of providing people with the kind of information that I do. The protocol, the narrative is they want you to be stuck on these medications for the rest of your life. Continuing to increase your dose, increase your dose, increase your dose. The narrative is you can't beat obesity. You can't beat diabetes. You know what I say? I say bullshit. You absolutely can. You can beat diabetes. You can beat obesity. But guess what? It's going to take some work. It's going to take mindset. It's going to take some aggressive lifestyle changes. And so what we do is very unique. We teach you, yes, that's exactly what we do, Michelle. My goal is to get you off as many medications as we possibly can. I'm very passionate in a more natural approach, but I embrace the medications because guess what? Obesity is a disease. Without a doubt, obesity is a disease. And if anybody wants to deny that, they don't know what they're talking about. But you know what? And so, people say obesity is a choice. They're very ignorant to what obesity is. But you know what is a choice regarding obesity? What is a choice is how you respond to the disease. That's your choice and no one else's choice. So are you going to roll over and succumb to this obesity brain disease and just say, well, the best I can do for myself is take medications for the rest of my life? Or are you going to sack up? You're going to step up and say, you know what? I can do better. I'm going to change my diet. I'm going to start exercising. I'm going to start prioritizing my sleep. I'm going to start managing my stress. I'm going to get a good supportive environment, some coaching, some guidance, some structure. That's what it's all about. Hey, Myrna, I see your text message and I see multiple attempts that we've sent you text messages, by the way. We sent you a text message on, well, actually, the last time you text us was in December, and then we sent you multiple text messages in December, never heard back. I'm sending you a text message right there so you can see, Myrna. Myrna, let me know if you got the message back. Gustavo, I'm on point 0.5, third, going to the fourth week of Wegovy, but I'm still overeating. So if you feel like you haven't gotten control over your food chatter yet, then there's many things you can do. So again, the narrative, the program by design wants you to keep increasing your dose, increasing your dose. That's certainly one thing you can possibly do. We will teach you to do many other things besides continually increasing your dose. Um, the fasting, the keto, the carnivore, all these different things contribute to more success long term. Looking for tweaks for my Tirzepatide to get maximum effects. So, Analytica peptides are phenomenal. Adding peptides to the regimen. So, you can add peptides, but more importantly, my coaching. This is, I think, much more important is to add the coaching so that we can guide you and help identify, do some labs, figure out what the issue might be. Hey, Adrian, what's up? Good morning, morning. How are you? Adrian says, let's go carnivore. Carnivore, carnivore, carnivore. It's a really good powerful intervention for sure. Okay, Murnav. So do you want to get set up for a consultation, correct? Let's see. There you go. So the consultation is actually completely free, just so you know. Insurance companies, unfortunately, don't cover any sort of coaching or guidance. Uh, Most people struggle to even get insurance company to cover the damn peptides. Unfortunately, we can't even get them to do that. Uh, do you work with insurance company? We talked about that. But the prices are very reasonable because we have different options. We have many different options, and what we're going to do is try to figure out the best option, a option that we can do. And somebody asked about the 503A retatrutide. So we do have that. You can access that. Just shoot us a message. Shoot us a message to get scheduled for a consultation. What are your thoughts on taking tirzepatide and semaglutide together? Um, I don't really see the benefit of that, nor do I think that makes sense. Doing lower doses, we do have, yeah, John, all you got to do is shoot us a text message to this number right here, and then you can get yourself scheduled for a consultation. Thank you, Adrian. You're the best. Um, Jen's filter. So when you message this number, you will be speaking to my staff. When you schedule that consultation, you're going to be speaking with one of my experts first. But then after that, you're going to eventually, like if you decide to, move forward with the program and you get signed up, you will work with me. The coaching programs are with me, guys. So if you're interested in working with me personally, if you guys want to get into my coaching programs, shoot us a text message with your name and your email and get yourself scheduled for that consultation, guys. When will Retatrutide be available in the UK? I don't know. I don't know what's going down across the pond in the UK. I'm not exactly sure how all that works. I know that a lot of people from the UK follow me. A lot of people are struggling to get the help that they need. So I know a lot of people from the UK are actually in my coaching programs. Um, let's see. What are your thoughts on creatine, Carol? I think creatine's great. Creatine is good to boost your strength. Creatine might even help your brain. There is some pretty cool information about creatine, and they were giving it to elderly. I don't know the age criteria, but they were performing better on cognitive testing evaluation just with creatine. So, the the creatine provides uh, some of that explosive, quick type energy by donating a phosphate. So it does provide energy on a cellular level in those pathways that can be supported, right? So I think creatine's amazing, and I think it's always been over dramatized as far as like concerns over taking creatine. Hey, John, thank you for doing these videos. I already referred one of my friends. 2 questions. Thanks, John. Why do you not like Sloop? It's too new of a research peptide. And honestly, we have so many tools already that I don't need to experiment with another tool that might be dangerous because it's new. That's my only reason. We're probably going to find out it's awesome, but we just haven't needed it. You have AOD, you have GLP-1s, you have lifestyle, and we've done really good with that. Toxin release to the gut during fat loss followed by gut reabsorption. Well, when you lose fat, you're releasing toxins. So we know that fat loss leads to toxin release, So because of that, it's a good idea to not also do a detoxification program, by the way. I don't like the idea of doing a detoxification program at the same time. But more importantly, I also like slow, steady weight loss, 1% of your body weight per week, and supporting your body, fasting, reducing inflammation, things like that. Maybe Kennedy will change all this healthcare that only treats diseases, not prevention. Yeah, Jens, I'm hoping. I'm hoping some really cool stuff can happen here. Analytica, how much is just the coaching program? So we have coaching packages that start off at $100 a month. My Flow student starts off at $100 a month, and then my Warrior goes up from there. So they can go over all of that with you during that initial consultation. John, I don't think you need binders, honestly. Why do you think you need to take binders? Binders also absorb a lot of the nutrition that your body needs. So I'm not a fan of taking binders unless you're doing some like really heavy detox type program, then maybe. It's January and I was registered nurse for 20 years. Fantastic. 20 years. Well, thank you for your support and helping people. That's amazing. We need more people like you. That's awesome, Jan. Melbourne, October 2024, GLP, GTT. Yeah, that's fantastic. That's awesome, Melbourne. I'm happy to hear that. We definitely want to continue to work on those enzymes without a doubt. John, can you talk about lowering blood pressure and cholesterol? Yeah, sure. You know, intermittent fasting and eating less carbohydrates are phenomenal for reducing insulin levels and reducing blood pressure. Cholesterol, I wouldn't worry about cholesterol. I don't know that you need to focus on cholesterol so much. I think you need to focus more on insulin levels. Just finished my morning cold plunge. That is awesome. Cold plunge. The cold plunge is something special. What's funny is we have the hot water is out right now, so we kind of have to do that. Good morning on my Instagram peeps. I have a question. What is worse for insulin resistance when it comes to fat loss? OMAD or eating 2 to 3 meals a day? I'm so confused. I don't know what you mean. What is worse? Oh, I guess. I mean, so the more you fast, if you fast correctly, that's going to be better for insulin resistance. So I guess what is worse would be eating more throughout the day. But it's not that simple because I notice with OMAD, a lot of people end up under eating. So I'm not a big fan of an OMAD approach per se. John, do you think AOD is necessary addition to the GLP-1? I like AOD, guys. You don't have to do AOD, but I do like AOD. I think AOD is a really good option because it mobilizes your body fat. Yeah, I think AOD is awesome because it mobilizes your body fat. Tracy, good morning. Can I hear your thoughts on stacking tirzepatide with retatrutide and AOD? I love it, Tracy. That's my go-to. That's my go-to. Tirzepatide and retatrutide are you don't need to do TERS and Reta though. AOD is great. You can do AOD with either TERS or Reta. Really potent options. Um, you don't need to do both. It just seems like a little overkill in my opinion. But everybody kind of has their own thoughts. I want to use the lowest doses of GLP-1s as possible. What is AOD? So AOD is a fragment of the human growth hormone. So AOD mobilizes your body fat. Yeah, I think AOD is really important piece because when you become insulin resistant, your body struggles to mobilize its fat stores. So more insulin resistance means more struggle for mobilizing fat. Hey, John, I appreciate that you're moving forward with the process to learn more. So my staff will call you whenever your scheduled appointment is, um, and that's pretty much how it works. John, if you were, I'm going to tell you this since you guys just scheduled. If you just scheduled, uh, I encourage you to take a look at the webinar that was sent. The webinar that we're going to send you is very detailed, and it's going to give you a better overview of how our program works. Hey, Sanin, thank you for reaching out, man. I appreciate it. Uh, I'm on 7.5 milligrams, and I do not plan to increase it as long as it continues to work. I love that, Sanin. Good for you, my friend. I think that's the right way. I really do. Do you have any advice on what to do when a weight loss plateau occurs? Yes, I do. Um, this is what most people reach out to us for. This is why people come to us to help them with that issue. How many people watching this are currently in a weight loss goal? How many of you guys currently right now are struggling? You were losing weight, but you're no longer losing weight. Let me know in the comments if that's you. And I definitely want to talk more in detail about how that works, how we can help you fix that. Uh, does that answer your question about the AOD? AOD mobilizes body fat. AOD is a fragment of the human growth hormone. I'm going to grab something, guys. I'll be right back on YouTube. Give me 30 seconds. So we got Monique, we got Renee, we got Johnny. Yeah, I think you'll be really happy switching from semaglutide over the tirzepatide. There's a lot of good options there. And the biggest thing that you want to think with is you want to make sure that you are approaching this in a sustainable manner, right? So, what other interventions are you doing upon switching? Carol, I had my blood panel done and my vitamin D was very low. What can I do to help that? You just take vitamin D, Carol. Yeah, you just add some vitamin D. I don't know how low was it. Do you remember your vitamin D score? Like your level? 5,000 IU's of vitamin D a day is good. You could probably, depending on how low it was, you can do more in the beginning. John John O'Mahony. What's up, buddy? Left field. Can you recommend a doctor for helping autism in a 4-year-old? John, I'm sorry, I don't know any autism specialists at all. So I'm sorry, my friend. Tracy, did that answer your question about the AOD and the retatrutide? Do you and I have a follow-up question for you as well. Are you set up for are you set up with good high quality peptides? That's one thing that I'm wondering. What type of blood panels can I ask my doctors to schedule to check my levels for almost everything? Yeah, see, the problem, guys, is your doctors, they don't order the kind of holistic and functional panels that we want to order, that we order. So we are looking at, first of all, we want to make sure your pancreas is okay. So we're doing lipase and amylase. And then we're also looking at a functional thyroid panel because a lot of you guys have hypothyroidism and it's not getting caught by your doctor. So we're doing a free T3, free T4, reverse T3. We're looking at a fasting insulin and C peptide. And we're also looking at inflammation. So we're doing a CRP and ESR. This is our how we start a more comprehensive approach. Yeah, most doctors only do basic panels, Carrie. You have to understand that your doctor, especially if he's going through insurance, even if he wants to order those panels, the insurance companies won't cover them. So standardly, he or she isn't usually working with these types of panels, unfortunately. Yeah, Carol, 17 is very low for your vitamin D. You want to have a vitamin D closer to like 50 to 60, in my opinion. So you might want to do like 10,000 IU's of vitamin D for maybe like 2 weeks or something, and then down to 5,000 IU's. Hey, Carmen, you started taking Monjaro yesterday. That's great. Honey, And anybody else watching, if you guys are looking to learn more, if you want to access some of the free resources or you want to get scheduled for a consultation, uh, you'd love to work with me directly, shoot me a message right here, this phone number on my chest. This is actually the best way to reach out to my team. So all you got to do is shoot us a text message with your name and your email. Let them know that you want to get scheduled for a consultation. Honey, let me know if you shoot us a message now so that I can make sure that you get set up in the back end system. Sanine, can Manjaro dosage be reduced at some point? So, guys, the question is, can I reduce my medication dose? Can I reduce my GLP-1? Well, first of all, I got to be clear. I can't give anybody medical advice, as you guys can probably think with. We can't do that here. But and if we're not talking about diabetes, we're not talking about blood sugar management, we're talking about weight loss. So, the way that we do this, the way that we accomplish lowering doses with our patients is by implementing lifestyle changes, by implementing strategic, targeted metabolic health strategies, fasting, keto and/or carnivore, lifting heavy weights, reducing inflammation, handling stress issues. These are the things that set you up for success long term. So, and guess what they do? They decrease your need for the medication. So, if you want our help, if you want our support, guys, reach out to us via text. But this is the reality of what we're doing. This is the magnitude of what we're doing. Let's rock and roll, baby. Let's do it. You know what I mean? Like it's it's very it's very much a reality here. Sanine, does that answer your question? 129 days till summer. Dr. Jones is going to be playing a lot of volleyball this summer, without a doubt. Lots of volleyball. Super excited for that. Volleyball is my jam. Uh, La Monique. No, we haven't dived into that yet. Just getting caught up. There's a lot of questions that I'm getting here on the different platforms. Carol, my doctor wants to prescribe me a high dose of vitamin D for 3 months, once a week, and she wants me to move up to 10 milligrams of Monjaro. So Carol, continuing to increase your dose to solve a problem of stalled results. Chewy, I love it, my friend. That Wolverine cycle is going to be really good. I like the Wolverine. So get ready to heal up. It's going to be great. Might see if I can stand up actually. Yeah, I was able to do that. That's awesome. I get a little tired of having to sit down. I like to stand up occasionally. Carnivore conference was cool. Yeah, I got to meet Steak and Butter Gal, and a lot of other cool people. Um, and yeah, it was a really good conference. What is the best exercise for fat loss? Probably the best exercise for fat loss would be high intensity interval training. High intensity interval training would burn the most amount of calories long term throughout the day, but it's also really potent for visceral fat. So yeah, I like the idea of uh, some more high intensity type work. So guys, if you just joined us here today, welcome, welcome. Um, my name is Dr. Jones. I have clinics we service across the nation, all 50 states. I work with my medical practitioners. They prescribe and I coach. So I think that what excites me the most is helping you guys achieve a future where you're set up for success, long term, minimal side effects, minimal complications, and long term results. That's what we do, and that's what people actually come to us for, is to solve that problem. We have a whole program that specializes in implementing the various lifestyle interventions. So it is possible to achieve permanent weight loss. It is possible. Is it hard? Yes. Is it possible? Absolutely. How do you do it? You got to fix your insulin resistance and you got to fix your inflammation. I mean, that's what it's all about. Linda, what do you think about breaking down this shot into 3 a week to reduce symptoms? Yeah, I think that's totally fine. We have a lot of people that split their dosing up, and totally viable, totally fine, not an issue. Chewy, just that a lot of people are transforming their lives with carnivore. That's what I learned. I mean, there's millions of people's lives transforming because of carnivore. So, guys, what do you want to train on first? Do you want to talk about weight loss stalls, or do you want to talk about peptides, inflammation, insulin resistance? Let me know what you guys want to train on. Let me know how I can help you guys best. Carrie, you said you have an appointment with us today, right? Which is awesome, by the way. Super stoked for you. What are your opinions about Lipo C? So Lipo C, lipotropic shots, uh, they're okay. You know, they help a little bit. They help a little bit, but they don't really. They're nothing magical. That's for sure. They're not. They're not transforming anybody's life. What's transforming people's lives is GLP-1 fasting and carnivore. That's what's transforming lives. Gary, super excited for you. As you know, if you decide to work with, after you speak with my experts, if you decide to move forward, you will absolutely work with me. And we're going to kick some ass. We're going to do this. We're going to do this long term. Renee, so carnivore is not necessary. I am going to tell you it's one of the top three, one of my top two lifestyle interventions, carnivore and fasting. But if carnivore seems too restrictive and it's not sustainable, don't do it. It has to be sustainable. The best diet for anybody, guys, is the diet that you can adhere to. The best diet is the diet that you can adhere to, period. So if you're thinking there's no way that all I can do is eat meat, then don't do that. But um, there's also other approaches too as well. The carnivore flexible approach, I think, is a nice pathway towards a possible future where you are living a more animal based diet. John, how do GLP-1s improve insulin resistance? By acting directly on the pancreas. So the GLP-1s, John, they act directly on the pancreas to improve insulin function. They improve the release of insulin. They improve the sensitivity of the body to insulin. So your blood sugar is lower and your insulin function improves. I am I soul if I'm pescatarian? What does that mean? Am I SOL? Oh, am I SOL if I'm pescatarian? Yes, I understand what you're saying. No, you're not. But I think that the movement for vegetarian and veganism, I I've just seen when looking at the vegetarian community and the vegans versus looking at carnivores, I've just seen a much better response out of a more animal carnivore based diet. I think a lot of people that end up improving their health on a vegan or vegetarian diet, I think it's one of those confusing scenarios where you're also improving so many other categories of your health at the same time that I think it kind of masks um, the actual issues that the vegetables are producing. John, does that answer your question? Do you believe in AI's anti-aromatase inhibitors when using testosterone therapy? Uh, Very minimal use, only when necessary. Anti-aromatase inhibitors, anti-estrogens usually create more problems because they're overused. You should use them generically. You should definitely not. You should only use them when absolutely needed. Yes, we do HRT, we do TRT. We have many different options to help you guys. Getting your hormones balanced is a huge piece of it. Low testosterone, suboptimal testosterone. Rocks the tox. I'm assuming you're referring to, yeah, to Robert Saleh. Robert Saleh is back in the. He's back to the Niners, baby. I think it'll be interesting to see what happens to us next year. I think that defense is going to be lit again, and Shanahan can focus on the offense. I think the Niners are going to be back in business. Yeah, the advisor position, guys, is a position for. Let's see, 1 second. The advisor position is working with individuals like you guys who want to schedule a consultation, who want to learn more about the services that we offer. That's what the advisor role is all about. The Super Bowl's in San Francisco next year. No way. I didn't know that. I didn't know that. Uh, that's our year. 2026 is our year. Everybody knows this. The Super Bowl, San Francisco, winning a Super Bowl ring in San Francisco, that would be amazing. Tom Brady won in Tampa. So that's pretty dope. Yeah, I would love to see that. Yeah, the Bears. Good luck with that, Roxy. I'm sorry. I don't have much faith for that. Oh, are the phone calls or video calls necessary? Is there a text alternative? Um, Asanda, in what world, and this isn't like an offensive question, I'm just genuinely curious. In what world do you think a text message conversation would be a viable option for us to have a conversation to figure out what you're struggling with and make a solid recommendation for all your questions? Like, I don't know. The answer is no, because that's not possible. It would be really challenging for us to have a back and forth conversation to understand what you're struggling with, what your issues are, why you have failed in the past, what you're looking to accomplish, and make a solid recommendation for you. Do you see how challenging that would be via text message? It would be really challenging. She says, "I'm not sure what a death skull emoji means." That's very that's very like. Does that mean you're mad? Does that mean you're like, oh, I don't want to do a phone call? Like literally, I can interpret the death skull anyway. It's my signature. All right, that's a little scary. I'm more messing with you, by the way. I just Hello, hello, everybody. Welcome, welcome. How is everybody doing today? We're just chit chatting about lasting weight loss strategies. Oh yeah, I'm here to answer, guys, whatever questions you have. Are GLP-1 safe to get online? Um, you mean from research companies? Not at all. It wouldn't be a good idea to get anything from a research company. I would strongly recommend that you get on a phone call with one of our experts and then let our doctors recommend and prescribe quality peptides and let us ship it to your doorstep. And then let's get into the coaching programs so that we can dial in the options. Like that's how we need to do this. Will changing the shot make a difference? Changing your injection site can actually tweak and change the absorption rates. So this is a big deal. On the short term, changing your injection sites can have an impact on absorption. Having an impact on absorption, though, is that going to do anything for you? Maybe on the short term, but long term, we got to fix your insulin resistance. We got to fix your hyperinsulinemia. We got to fix your inflammation issues. That's what we need to do. Mama of four. That's what we do. This is what we specialize in, guys. I can't stress enough how important it is that you guys think of the future, that you think of long term. What's the future going to look like? How should I approach it? What are the decisions that I need to make now that are going to affect the future? These are the things that you should be thinking with. Because if you're not, how do you plan to be successful in the future? When it comes to lasting weight loss, you guys already know how freaking challenging this is. You already know how like how much struggle there is. And so I can tell you guys that if you want to do this right, you have to fix your hyperinsulinemia. You gotta lower those insulin levels and you gotta control your calories. The good news is when you fix your insulin issues, controlling calories kind of happens at the same time, which is awesome. How's everybody doing on YouTube? And we got 9 people watching on YouTube, 8 people watching on X, the old Twitter. Mama 4, I will text later. Yeah, no problem. Just this is the best number to reach out to us. So just screenshot it, hold on to that number, and we'll get you rocking and rolling. Does your program allow me to get off my high blood pressure and cholesterol medications? John, absolutely. In fact, this is my goal. My goal is to get you off of those blood pressure medications. My goal is to get you set up so that you're stuck on these medications. That's literally what I want to do, by the way. And I think I would imagine you want to do that too, right? How many of you guys like the idea of getting off your medications? You guys like the idea of a program that focuses on health, getting off medications, not getting on medications, but getting off. I don't know about you, but for me, it's always been about that. It's always been about optimizing your health long term. Patricia, I was on Ozempic, lost 39 pounds, changed my diet. I was only getting a shot every 2 weeks. Been off the shots since December 23rd, maintaining diet protein. Have not gained back any weight, actually down an additional pound. So, what's your question? Oh, you're just wondering, like, why are you not regaining weight? I wouldn't question an awesome thing. There's always exceptions to the standard. There's always exceptions to the rule. So consider yourself lucky. Keep moving forward. Keep making the right choices, and this is a good thing. This is a really good thing. I would be happy. Moderators, I'm gonna try going live from my blue check page. I just want to see what happens. By the way, so we got Chris, we got Valerie, we got John. Everybody would be stoked about getting off freaking medication. This is what we're going to help you do. Without a doubt, our goal is to help you get off these medications. Like, this is what I'm pumped to do. So moderators, let's have some of you guys hop on the blue check page. I just want to see what happens. John, I got to head to work. It was a pleasure. My appointment is for February at 10:30. It was awesome, buddy. Kick some butt. Have a good day at work. And yeah, man, let's get your health goals rocking and rolling. We'll see you later, man. Nobody there. Let me know, Patricia, if that answered your question. See you later, John. Welcome, welcome, everybody. We're just chit-chatting about GLP-1 weight loss and lasting weight loss strategies. And so let's talk about insulin resistance. I think insulin resistance is a really important topic to understand. Uh, what what is insulin resistance? Why is it a problem? Why does it slow down your GLP-1 results? Uh, Hyperinsulinemia is the ultimate culprit to weight loss struggles and weight loss issues. I want to get into this, guys, because I think it's important. A lot of you guys are on your medications and you're struggling. You're experiencing slow results, no results. And you're also wondering, hello, Natty. You're also wondering long term how how you can be successful long term. And truthfully, the way to be successful long term is to lower your insulin levels to address the hyperinsulinemia. And so the quick kind of overview is the relationship starts with lifestyle interventions that lead to elevated insulin levels. Now, remember, there's multiple ways that your insulin levels can initially raise that lead to insulin resistance. But the overview is you elevate insulin chronically over time. That leads to insulin resistance. That leads to hyperinsulinemia. So before we get into this, guys, because I want you guys to understand this, Natty, I tried the love handles as injection sites and it worked wonders for me. That's great. No, that's awesome. That's awesome. The always circulating different locations, different different signs of the body, different locations can have different absorption rates. So I'm glad that you were able to find an area that worked and had a good positive response. So, guys, if you just joined us, welcome, welcome. We're going to talk about peptides. We're going to talk about hyperinsulinemia. Yes, Jade, hyperinsulinemia, elevated insulin levels can lead to, let me know if the audio is better, lady. I just increased the volume. Hyperinsulinemia can lead to food chatter, without a doubt. So, guys, we're going to talk about insulin resistance and hyperinsulinemia here for a little bit. By the way, this phone number here is actually the best number to reach out to my team. Let me fix that quick. There we go. So feel free to shoot us a message, get yourself scheduled for that consultation. If you guys are looking for a solution, if you want to work with me, if you want to work with my team, it all starts right here by shooting us a message. Linda, I'm on Mounjaro, 15, 1.5 years, gaining weight. We're going to talk about that, Linda. We're about to talk about why you would be getting slow results, no results, or why you might be gaining weight. I can tell you it almost always boils down to hyperinsulinemia, inflammation, cortisol issues, or thyroid issues. It's almost always one of those categories. And so navigating around those categories is very, very important. So I'm gonna teach you how to fix that. And I'll do my best to kind of answer questions for you guys in between as well. So in order to understand insulin resistance, risky biscuits, I don't agree with that. I don't think the GLP-1s will create insulin resistance in the long run, but I do think that long term, it's not ideal to stay on medications if you don't have to stay on them. It's always more optimal for your health to not stay on medications. Oh yeah, lady, you're gonna have to remind me afterwards to make you a moderator on all the accounts. Do that. Send me a message to both of the other accounts so I can make you guys moderate. Um, in order to understand insulin resistance, you need to understand. Risky Biscuit says just because you don't agree doesn't mean research proves it. Uh, totally fair. Totally fair, Risky Biscuits. Um, even if the research did prove it, does it actually pan out in reality, right? So, I mean, you don't even have to listen to me right now, but I recommend you do because I think you're going to understand that at the end of the day, um, there are multiple ways to approach health. And when it comes to research based methods, sometimes it's very challenging and difficult to actually reproduce the same scenarios in from real life to replicate it in the research. So a lot of these things in the especially in the holistic and natural realm, we don't have research for. We don't have research to prove carnivore. We don't have research to prove many different issues of health. And so you got to be able to think with that because intuitively you want to base your decisions off research and you should, but you also have to be able to make decisions outside of the framework of what hasn't been researched. So I'll just leave it at that. Risky Biscuits, but please continue to ask any questions. So, in order to understand what insulin resistance is, you need to understand the function of insulin. Insulin is a storage hormone. It's not just your blood sugar controlling hormone. Insulin is responsible for getting the sugar out of your blood into your cells, as well as storing protein, as well as storing fat. Insulin is a very anabolic hormone. It's very pro storage, pro growth. Insulin is not supposed to be elevated throughout a 24-hour period. In fact, insulin is supposed to only be elevated in response to the elevation of blood sugar in response to eating food. So you eat food, and that's the only time insulin is supposed to be elevated. So if you were to look over a 24-hour period, insulin is not that elevated. T-Bird, we're gonna talk about peptides, but I would love to answer your peptide questions after we take a deeper dive into it. So insulin, when elevated, is putting your body into a state of storage, into a state of growth. As you start to become insulin resistant, and there's many things that can create the initial insulin resistance. Many things. I can't possibly talk about all of them. I'm just going to mention the category: lifestyle, cortisol, inflammation. There's some genetic predisposition that we think probably exists too as well that leads to insulin resistance. So as you become resistant to insulin, which is your body's responsiveness decreasing, now whenever your body needs to control blood sugar, your body has to produce and release more insulin. So this condition known as hyperinsulinemia is really just a byproduct, a result of your body being resistant and needing to keep bringing down the sugar. Well, where does the need come from to bring down the sugar? Well, what are you doing to raise blood sugar, guys? Let me know in the comments. What are the things that you do on a daily basis that raises blood sugar and creates the need for the insulin resistance to get exacerbated? How can you decrease the need for your body to release insulin? Or in other words, what can you do to it to decrease the need for your body to have to fight the blood sugar? It's always having to lower blood sugar. Well, how can you reduce the need? Do you really lose muscle mass with every shot? No, you don't. I would argue all day that when used properly, these GLP-1s are probably anabolic. They probably support muscular growth, not the other way around. But they're not used correctly. They're not used the right way. And that's the issue. How long before you start seeing results from retatrutide depends on what else you're doing. You're dialing in the lifestyle. Nobody can answer that question, William, because it's a BS answer. I don't know what else you're doing on the sideline. But if you got things dialed in, also, how insulin resistant are you, which is what we're talking about now. It might take 2 to 8 weeks before you feel it. Of course, working with us, we're going to help dial that in and we're going to help speed that process up. Too much processed carbohydrates. Andy is correct. Thank you for that answer, Andy. If you're still with us, consuming carbohydrates is the most direct effect that you have on raising blood sugar. So, what do we got to do to reduce that need? How do we fix that problem? Eating carbohydrates raises blood sugar and creates the need for your body to release insulin. So how do we fix that? How do we do a scenario? How do we implement a scenario? What does that look like when we're eating less carbs or no carbs? Fasting. Love it. Fasting is a big one. But without starving yourself, because if you starve yourself, if you're not getting enough calories, well, that's a whole nother problem. We can't create another problem because I'm telling you, if you don't eat enough food, you're going to create starvation mode too as well. So we can't have that problem either. So what's the solution here? Protein helps in keeping a high enough intake of protein, very important, but that's not going to be the solution here. The solution right now, we're trying to fix our hyperinsulinemia. We're trying to lower those chronically elevated insulin levels. So how do you do that? Fiber can help. There's another big one here, guys. What kind of dietary style, what kind of interventions, what kind of lifestyle strategies will lower your carbohydrate intake? Exercise is good. Exercise will definitely help because you're going to burn up those carbs. Andy, thank you, my friend. I do my best to help provide people with solid understanding and a framework of what they need to do and what they need to understand in order to fix the actual metabolic issues. So we got keto and carnivore. Heather, you nailed it. Dietary interventions that are going to lower what's banting? What's banting? I don't know what banting is. Is this something that I've never heard of? Do you mean fasting? Fasting slash keto slash carnivore, without a doubt, is the fastest way to lower your insulin levels. Period. Now, what does that do for you in the long run? Well, if you're insulin resistant and or hyperinsulinemic, it's going to make it significantly easier for your body to begin to mobilize fat. It's going to make it easier for your body to start burning fat. Without a doubt, because it's the chronically elevated insulin levels to begin with that's creating the issue. See, the reason why GLP-1s are so awesome is because GLP-1s directly reduce insulin resistance, which is the same thing as making you more insulin sensitive. So you become more insulin sensitive, you become less insulin resistant. It also suppresses your appetite. That's the perfect storm for weight loss because weight loss requires two things. Well, let me rephrase that. Fat loss, continual fat loss requires two things. You got to be in a calorie deficit, but if you want long-term weight loss, you need to lower your insulin levels. And I think this is where people get stuck because the literature shows you don't have to worry about insulin, but the literature is not reproducible. You can't reproduce that environment in the real life. In the real life situation, you're not in metabolic wards where somebody's forcing you to only eat, right? If eating at a calorie deficit was this easy, we wouldn't be in a problem of obesity. But in the real world, guess what? You have hunger, you have cravings, you have binging issues, you have all sorts of problems that prevent you from eating less. What do you think is driving those issues? Part of it is the freaking hunger and food chatter that comes from elevated insulin levels. Because elevated insulin levels, stress is a big one. But what does stress do? Chronic stress means elevated cortisol. Elevated cortisol means elevated blood sugar. Elevated blood sugar means elevated insulin. So, yes, stress is its own problem, and you need to fix stress in order to fix insulin. But it does ultimately come back to an insulin issue. Um, you can test cortisol with there's a salivary test, there's a urine test, but after years of doing that, because it's not cheap, you don't really need to test cortisol in most cases because everyone's going to benefit from some stress management in their life. So if you know that you have chronic stress, like you're just aware of it, most of you know, yeah, my life's pretty stressful. Some of you could be exaggerating, I don't know. But intuitively, stress is relative, anyways. Is it stressful for you? Then it's stressful, right? So if you're aware of stress in your life, then that means you probably have some elevated cortisol. And it would be really, really valuable for you to do some stress management techniques. You don't need to chase it with a test. I mean, you can, you don't need to. It's also, I'd rather the money for the test go towards the solution. Ashwagandha and other adaptogenic herbs can be very helpful. That's where the adaptogenic herbs come into play. The adaptogenic herbs are various like ashwagandha, holy basil, panic ginseng. These herbs improve the body's stress tolerance, which is very, very important, by the way. Stress eating is absolutely a thing that seems to be associated with elevated cortisol. So, and these are just one of the many different things that we would help you out with in our program, guys. This number right here is the best number to reach out to my team. If you guys are looking for guidance, if you're looking for support, if you want to work with me directly, shoot me a text message here, guys. We do have a ton of different options, a ton of different coaching programs and options to help you guys out. The big thing that we want to do is get you set up with some proper lab testing, test for inflammation, insulin resistance. And then we want to get you to work. We want to start coaching you to change your dietary strategies, your exercise patterns, stress, sleep. We want to get into all of that. Glands Girl, it wasn't a conference, it was more of a meetup. The word meet up, MEAT, which is funny. Uh, yeah, it wasn't a conference, it was more of a meetup. And so yeah, I got to meet some really cool people. Um, so we were talking a little bit about insulin and the ramifications of hyperinsulinemia, chronically elevated insulin levels. Um, when you have when you have elevated insulin levels, it's what it ultimately does for the body is produce resistance to weight loss and resistance to weight maintenance. It's as if it drives this set point that that challenges you to maintain your weight loss. Your metabolism slows down, your hunger increases because your body wants to continue to regain that weight back. And it seems like from observing and working with thousands of individuals, there was meat everywhere, chewy. There were just little pieces of steak everywhere. Nah, was that's really funny though. Um, it was cool though. Um, but things that make this challenging, that the insulin resistance and the inflammation, um, they influence your hunger, they influence your metabolism, and those things are out of your control. And so if you want to make it easier for you to lose weight, if you want to make it sustainable, and you don't want to have to rely on continual increases of your medication, continual increases of your different peptides, and you want to just have this sort of like scenario where you can just maintain, which is I think ultimately what we all want, right? You got to fix the metabolic health. You got to fix the metabolic health and you got to maintain it. And that's where we come in with the coaching, the strategies like fasting, carnivore, keto. Chris, thank you so much. I'm glad that you're enjoying the program. I'm glad that you're kicking ass. I love it. Super stoked for you. The feedback is very much appreciated too as well. So thank you. Oh, Andy is Mossman. That's cool. All right, guys, I am going to hop off here. Any last minute questions before I end today's live? Just so you know, you guys, I go live every single morning at 5:30 a.m. Mountain Standard Time, Monday through Friday. You can catch me on the weekends at 7 a.m., 6:37 a.m. Mountain Standard Time too as well. So make sure you're following me on TikTok. Make sure you're following me on YouTube and the podcast. Um, the YouTube and the podcast is where you can really sink into my deeper educational content. Knowledge is power, as you can possibly imagine. And if you want to learn all these different strategies that we're teaching you, then you need to hop on that YouTube and you need to check that out. We can, if you can't find our YouTube or our podcast, then all you got to do is shoot us a message and we can send you the direct link. Yeah, I do hit on carnivore, Juan. The body is very you are able to do hit and things like this on carnivore. It is possible. It does take time for your body to adapt, of course. Thank you, Kay. Um, Again, this number here is the best way to reach out to my team. So if you haven't already, shoot us a message, get yourself scheduled. Let's kick some ass. You guys are working too hard. You are working too hard to not be getting the results you want to get. And if you are getting weight loss results, are you getting results that you think are going to be permanent? That's the $1,000,000 question that you need to ask yourself. I can't answer that question for you. Only you can. Um, Hey, Melissa, you can actually get the GLP-1s and peptides from us. This number right here, we ship all 50 states, and then you'll get access to my coaching, the guidance, the support, all of that is available to you guys. Just shoot us that message here with your name and your email. Good morning, Bella. We're hopping off now. So just wanted to make sure that you guys got that last message. Melissa, shoot us a message here. Looking forward to it. You guys have a great day, everybody.